Welcome back. Believe it or not, 25 to 40 million Americans have problems with varicose veins, and in the past, some of the treatment has involved things such as vein stripping. But thanks to new technology, there's a quicker option that can pretty much be painless for patients and a lot easier. Well, here to tell us more about it, we welcome Dr. Sloan Warner, a vascular surgeon with Lexington Clinic. Thank you so much for being with us today.
Of course. Great to be here.
We'll start, I guess, with the way things used to be. What is the difference that technology has made in how patients can get treatment for varicose veins?
Well, varicose veins occur in the legs, and normally the veins themselves are pretty small and we hardly see them at all. But when they get really dilated and swollen and bulge, they can cause all kinds of throbbing and aching, and it can be a long-term terrible problem for patients. The old way we used to do it was to make larger incisions in the operating room. You had to go to sleep, and you would literally rip the vein out of its bed, and it would slowly stop bleeding with some pressure. But it was a couple of weeks before you went back to work. But the newer way to do it is an office procedure. It's a ClosureFast method, and it is fast because it takes about an hour. It's just some local anesthesia. Most patients are awake. Some patients are a little sedated if they prefer. And we just make a small incision, maybe a quarter of an inch by the knee, with some local numbing medicine, and use a long catheter. It's almost like a lamp cord, and it's slid up the inside of the vein towards the groin. We numb the vein up some more from the outside and use the energy of that to scar down the inside of the vein. Most of the veins have problems where the blood is going the wrong way and it's sliding back down towards the foot with gravity, and that makes the varicose vein so much worse. But if we use the energy of that catheter to destroy and scar down the inside of that vein shuts down and the varicose veins are either totally eliminated or we can do a little touch-up work later on. But it's a big change in how quickly they can go back to work, and the amount of overall discomfort. It's only Tylenol after the procedure.
Wow. And we should mention that some people think of varicose veins as just being a cosmetic issue, but as you said earlier, it can actually cause some complications and pain for patients, right?
Absolutely. In addition to the pain and the swelling, over time you can have problems with darkening the skin, damaging the skin in your lower legs, even ulcerations. And there's the more varicose veins you have, the more likely you are to get clots in your deeper veins as well, perhaps on a car trip or an airline flight.
So if folks are listening now and they are interested in seeing if they're a good candidate and if it would work for them, what should they do?
You can call the Lexington Clinic. I'll be glad to see them at any time.
Wonderful. Well, thank you so much for sharing that technology and sharing information with our viewers on varicose veins.
Okay, thank you.
Thank you. Dr. Warner with Lexington Clinic. If you're interested in learning more about the procedure, you can get in touch with his office at the Lexington Clinic. We'll be right back with one last check of your forecast.